Good morning. Welcome into another edition of the Augusta Business Review here on News Talk WGAC. I'm Bill Botham. Very happy to say hello once again to Dr. William Schiff from the Augusta Pain Center. Good to see you again, Doctor. Thanks for coming back by.
Thank you. It's good to be back.
You are the psychologist out there dealing with the behavioral health services, I guess. Again, you've been here before, but for those who didn't hear you the previous visit, kind of run through what your responsibilities are, if you will.
So as the psychologist at Augusta Pain Center, I have a couple hats that I wear there. One of them is to do evaluations to identify what we refer to as assets or liabilities for the treatment of chronic pain, to make the doctor's job easier in regards to treating that individual, to maximize the chance of success and minimize risk. Another hat that I wear is an educational part. I'm able to spend a lot more time with each individual patient to be able to explain each question they may have or answer every question they may have to a level of detail they may feel satisfied with. The third hat that I wear is for treatment, looking at behaviors, thoughts, or other things that may not be helpful in regards to living a life successfully with chronic pain. And if we were able to identify those things to help make the change towards something that's more helpful.
I guess that's where the behavioral pain management would come in.
Correct. A lot of people struggle with chronic pain, and it really affects the quality of life. If you really can't do the things you really love and enjoy, it can be very difficult. And just the nature of the pain makes it even harder to even counter some of that. A person may be only able to do so much in regards to pushing themselves through it before they just kind of give up because it's hurting so much. So trying to live gracefully with the pain or make some of the changes that will make their life better can be a little bit difficult and maybe even a little counterintuitive.
But now some of our listeners might say, I don't want to learn to live with the pain, I want to get rid of the pain.
We do try to treat the pain, but in some cases there is no getting rid of the pain 100%. As much as we would like to turn back the clock, we don't have the ability to clone new body parts or de-age the person. So in some circumstances, they may have to learn to live with it. Now, we could manage it and address some of that to make them more comfortable, but some of the basic stuff may still be there, and we may not be able to get it to 100%. We'll get as close as we can, but there is a balancing act there.
And that live with whatever degree there is and manage it to make life more enjoyable is a big part of where you come in when you meet with the patients.
Correct. A lot of it is about quality of life. There are individuals who have chronic pain, individuals with other really serious medical conditions that do have a life that they can be pleased with. An amputee may never be happy the fact that they have no limb, but they still can have a good life.
Oh, good point. Now, do you meet with every patient that comes out to Augusta Pain Center?
Most of them. Not every single one, but most of them.
And I guess you begin the term you told me before we went on the air is with biofeedback as you're talking with them. Explain that process and what that means to the patient.
So biofeedback is a specific skill training on teaching a person to be able to control specific unconscious processes of the body, things that may not be so helpful when it comes to pain. Pain's a stressful thing. You step on a nail, it hurts. Your body's saying, run away or kill whatever's hurting you. You think about the last time you stubbed your toe. I could think about it and I'm just like, Our body tends to respond in specific ways. And when it comes to chronic pain, that natural response isn't always helpful. In fact, it can be a problem, make the problem a whole lot worse.
How so?
Biologically, when your body goes into this fight or flight response, a couple things do occur. Now, I'm going to oversimplify it here, but you do have muscle tension that develops. You think about tension, the tension that may develop in the areas of the body that are already damaged. Now you're generating more pain information. It also has to do with the transmission of that information to the brain. If your body's in that specific mode, the sympathetic response with the fight or flight mode, you're getting a lot more information going to the brain, including pain information. So it can make it very difficult. It doesn't really make your pain rot or break down or essentially worsen in those regards, but you're getting a lot more information to the brain, so your experience is a lot worse. It feels like you're having a whole lot more pain.
Some examples then of how the patient would benefit from biofeedback.
Biofeedback is just some skill training. Now, if you were to ask most patients when they're having a lot of pain, what's one of the first things they do? They may say, well, I lay down or I take a nap, I rest. Afterwards, they may feel a little bit better. And it's a pretty natural response to do that. You rest, you recover, and you kind of move on. Unfortunately, it's not a very efficient process. One, you have to be home, and that is not always available because then you might be stuck at home. I can't lay down and take a nap up in a doctor's office as much as I'd like. Your office is pretty comfortable here, but I wouldn't want to lay down in front of you.
No, I would not. Absolutely not. I sure wouldn't in the middle of the hardware store or an amusement park or anything else. Good point.
Also, is a big investment of time. Laying down, taking a nap. It could be an hour or two. What biofeedback would do is teach you to be able to kind of maximize that same type of response or the benefit you're getting from that. It's in a shorter period of time. Your body's shifting into that rest mode, that relaxation mode, and thus you're getting some of that benefits, but you could do it anywhere. For example, doing a breathing exercise in a doctor's office, no one's going to really look twice at you. You could do it in a shorter period of time. Depending on how skilled you get at it, you might be able to do it within 15 minutes or even less. Your body's shifting into this other response, which gives you some relief.
It's Dr. William Schiff from the Augusta Pain Center. You can find them on the web at AugustaPainCenter.com. Telephone number, very easy, 706-738-PAIN. That is 706-738-7246, 738-7246. Located just behind Doctors Hospital on Interstate Parkway, right at the intersection of Interstate Parkway and Perimeter Parkway. We're going to talk more with Dr. Schiff here in just a moment after the break about some of the things that you can do to manage your pain. We'll be back. This is News Talk WGAC. Welcome back into the Augusta Business Review here on News Talk WGAC. Bill Botham chatting with Dr. William Schiff from Augusta Pain Center. Find them on the web at AugustaPainCenter.com. And you can hear all of the prior interviews that we've done with the various doctors from Augusta Pain Center. They are cataloged there at AugustaPainCenter.com. And Doctor, as we went into the break, I promised listeners that we'd talk to them about some of the things they could do to help manage their pain better, how they could help themselves. And this comes through, I guess, what you entitle as cognitive behavioral therapy.
Cognitive behavioral therapy is something that's applied to a lot of different things, but I guess what it boils down to is looking at things or thoughts, things we do or thoughts that work for us or things that work against us, to identify the things that work against us and to change it to something more advantageous. When it comes to chronic pain especially, as I kind of have mentioned before, it's very counterintuitive sometimes on some of the things we need to do. And a lot of the research kind of identifies some of the core traits you see in common among individuals who tend to do best. So CBT in that case would look at what behaviors that person is doing which might not be helpful and trying to make that change to something that would be helpful.
An example would be?
So sleep is a common problem that a lot of individuals with chronic pain have, or difficulty sleeping. They had individuals who said they only sleep 2 hours a night, and I don't know how they do it. I'd be a zombie at that point. And some of them do kind of feel like zombies. Now, pain does play a role when it comes to a person's ability to sleep, but there's also a lot of other factors that may occur. Without pain, they could have been doing some of these things, and it wasn't a big deal, maybe only 6 hours of sleep, or it wasn't becoming a major issue. But you combine those factors, those behaviors or things that you do with pain, it becomes very difficult, or even more so. For example, watching TV, having different sleep times, these things we would probably put under what we refer to as sleep hygiene. So identifying behaviors they might do, like sitting in bed watching TV or taking naps during the day, would educate the patient on how that might not work out or how that might be an issue, and then try to help them make some changes towards something that's going to help them better. In most cases, we see that a person's sleep does improve.
Getting a good night's sleep is, to me, one of the most impactful things we can do.
Oh, yes. Sleep is a major factor when it comes to chronic pain, and as well as quality of life issues. There's a lot of recent research coming out from the pain physicians indicating sleep has a major role in the development of chronic pain. So getting control of that, very important.
One of the other areas that you have mentioned to us is in anger management.
It becomes a thing that feeds into itself. So a person may not even have any anger issues, but they're hurting all the time and they're stuck in that fight or flight mode. And you think about the two most common emotions associated with fighting or fleeing. The fighting, of course, is anger, and fleeing is fear. So they may actually have more anger or find themselves more snappy or irritable, or the frustration tolerance is much lower. While that's quite common, it's actually something that works quite against them when it comes to pain. And it goes back to that whole fight or flight response, that their body's more primed to transmitting this information and they experience a lot more pain. So
we're back to that stubbed toe, which I know how frustrated I am for the next however long I'm still feeling the residual pain from stubbing the toe. I'm in a grumpy, frustrated mood just because I'm mad that I stubbed my darn toe. And I'm liable to snap at anybody, and they had nothing to do with me having stubbed my toe.
Yeah, you stub your toe and a little bit of time goes by and you might feel better and you feel kind of foolish. I just got so mad at no reason. But imagine that was 24/7. You're hurting all the time and someone comes and asks you a silly question or you're stuck in line. What we would do in situations like that, and this would include some of the stress management stuff, is effective communication. Someone's bothering you or irritating you. A lot of people would try to ignore it, or maybe they explode or something, but try to be able to resolve problems sooner, be able to recognize when problems are occurring, strategies to effectively resolve those things so you won't get so angry so quickly, or if you are angry, you're able to resolve it more to your satisfaction. Same with stress. Effective problem solving, identifying problems, how to best solve it. How often have we had issues, you get something and you panic and you don't know what to do? This kind of breaks down some specific stages or steps to kind of map it out for you so you have a plan. You don't feel like you're just kind of lost. You're like, okay, what do I do now? Oh, Dr. Schiff said do this, and you could break it down and maybe have it a little bit easier time resolving that stress.
Stress, pain, anger seem like first cousins as you describe them, and like some relaxation training might be beneficial in all of those areas.
Exactly. Relaxation, be able to take it easy, be able to maximize your recovery, and biofeedback ties very much into that. There's a lot of different ways you could relax. Biofeedback is specifically using a tool to show how your body's actually moving into that relaxed state. So some individuals may have had experiences from other things with like breathing exercises or progressive muscle relaxation, but we try to tie it into different tools to show that their body's actually going into that mode. They're just not breathing and saying, yes, I feel better. No, they could actually see their body shifted into that relaxation mode.
Well, that's great. If you're dealing with pain, trying to live with pain, call the folks out at Augusta Pain Center, 706-738-PAIN. That's 738-7246, located right behind Doctors Hospital, just off Wheeler Road, 1321 Interstate Parkway. All the information is at AugustaPainCenter.com. Doctor, thank you again for coming by. We appreciate your time.
It was my pleasure.
Your time.
It was my pleasure.